All right, last video on our module and anxiety-related disorders is on treatment. How should anxiety disorders be treated? Fastest treatments, what works the quickest, and which are the most effective in the long term. So first off, some good news. Anxiety disorders are among the most treatable of mental or mood disorders. How should anxiety disorders be treated? They can be treated by interrupting or changing the learning surrounding the anxiety disorder. So helping someone see, first off, maybe how their maladaptive behavior is hurting them. Also, maybe helping them see that their thoughts or their behavior is not rational. There's something called cognitive behavioral therapy, which we will talk about more in a second. It would be super helpful in helping a person to realize that maybe their behavior, their thoughts are more harmful than good, and helping them realize how to change them. Anxiety disorders can also be treated through medication. What treatments work the fastest? Medication, biological treatments offer fairly immediate relief by reducing or eliminating some of the anxious symptoms like the sweating, the increased heart rate, etc. They can also produce increases in serotonin, which we discussed earlier this week. Really helps to regulate not only our sleeping patterns, but also our moods, our ability to handle stress, our emotions, our reactions to things. Without that increase in serotonin, we are unable to even begin to change our behavior. What treatments are most effective in the long term? Medication is only effective as long as people take it. I gave the example of my brother and PTSD. So he is on anti-anxiety medications. To be honest, he's on a host of other medications as well. When he does not take his medication, the effects that it has on him quickly disappear. So medication only helps as long as they're taking it. Behavioral or psychological treatments, such as counseling therapy, take the longest to work, but they have the best long-term outcomes. So even if you do not continue the counseling, you can continue to reap the benefits of it. Sometimes the fears or disorders do come back, especially if people do not continue to work on the fear or expose themselves to it or continue to. So remember, we've been talking about negative reinforcement, where we don't put ourselves in the situation and then we're reinforced. Yay, I wasn't embarrassed because I didn't put myself in the situation. So if you continue to not put yourself in the situation, you're going to feel better in the short term, but all you're really doing is strengthening that disorder. So cognitive behavioral therapy, CBT, is short-term, goal-oriented psychotherapy. So you would go in with a goal. If you have a fear of spiders, your goal would be to get over your fear of spiders. It is hands-on. It is practical approach to problem solving. So it's not laying on the couch and just talking about the disorder. CBT focuses on changing patterns of thinking or behavior in order to change the way the person feels about the situation or the thing, change the way the person feels about, social events or spiders or what happened in the past. Especially with like PTSD, we can't deny the things that happen. We can't deny the trauma, but we can change the way that we think about them. CBT focuses on the thoughts, images, beliefs, and attitudes that are held about the event or the thing. So it deals with the person's cognitive processes, cognitive behavioral therapy. And then it deals with how these processes relate to the way a person behaves. So that's the behavioral part, as a way of dealing with the emotional problems. So again, CBT focuses on thoughts, images, beliefs, and attitudes that are held by a person, and how these processes, these thoughts, images, beliefs, and attitudes relate to the way that the person behaves in order to deal with their anxiety, their anxious thoughts. One treatment, they might use a fear hierarchy. So in CBT, it's very hands-on, short-term. You are going to, if you have CBT therapy, you are going to work at facing one of your fears. So maybe the very first time that you go in, you talk about your fear of dogs. Remember Sweetie, the dog. Talk about your fear of dogs. You're going to earn 10 points by putting yourself in a room with a lot of dog toys. Maybe that's enough for you right now. That's all you can handle, right? The next time, you're going to earn extra points by smelling a dog or the scent of a dog and not panicking and realizing, hey, I'm okay. Okay, I got this. You're going to earn 50 points by hearing a dog barks and you don't panic, right? You don't break out in a sweat. You can handle it. You don't have to jump up and run. The next step, and these are not all done at the same time, these would be done over a process of several weeks. The next step, seeing small dogs. The next step, seeing big dogs, but they are not golden retrievers. Remember, Sweetie was a golden retriever. Once you can handle big dogs, then you're going to move on to golden retrievers without panicking. Lastly, seeing Sweetie, the golden retriever, the dog that caused the fear, the panic, the bite, remember as a bite, in the first place when you were a child. Okay, so that is a fear hierarchy. We can use that with any number of fears, or so like if you have a fear of spiders, maybe you start out with looking at a picture of a spider, then the spider goes in a jar, then you sleep with a spider in a jar by your bed. That's never going to happen to me. And then you let this spider crawl on your body. That would be one way of using a fear hierarchy in a treatment for a fear of spiders. Okay, that is CBT. Cognitive behavioral therapy. Again, we would use a mix of medication. Medication works quick. A mix of medication and of counseling therapy techniques in order to deal with any and all of the 5 main categories of anxiety that we discussed. So the generalized anxiety, social anxiety, the panic disorder, the PTSD, and also the OCD.